Good afternoon. My name is Lindsay and I'm an RN to BSN student here with McKendree University, finishing my degree online. I did my practicum at a behavioral health unit in Amory, Wisconsin, a small rural town about an hour north of the Twin Cities here in Minnesota into Wisconsin. The behavioral health unit is a 10-bed facility. It's a locked facility, inpatient. It treats geriatric patients. That's 45 years old and above. Now, they primarily see dementia patients, but they do have other difficult behaviors coming into the unit. At that time, we decided, the preceptor and I had decided that communication was going to be the biggest hurdle to overcome, just due to the changes the facility itself had gone through in the last few years. A little background history. Amory, Wisconsin is a very small rural town, and this one medical facility or hospital that services the town and the outlying areas was bought out by Health Partners, which is a major system up here in Minnesota and Wisconsin. So due to these changes of going from a small town hospital into a system, they've had some policy and procedure changes. They've also had management changes. Wendy, the preceptor I followed, she's only been in her position for 3 years. So she's come in and kind of disrupted their flow. They're used to a certain manager doing it a certain way, and she kind of does things a little differently. So the staff there has had to kind of get used to how she runs things. So she's trying to feel them out and trying to communicate with them and learn how they communicate, and as well as they're trying to learn how she communicates as well. So in that first week when we had to do that interview with our preceptors, we kind of narrowed down some things that we thought would benefit the unit overall, and it really came down to communication. They function well as a team, but they don't really communicate well with each other. So there's a lot of small arguments or misunderstandings or a lack of retention due to the stress that's caused by things being passed down from management into the staff members. So it was kind of suggested to me that if I could base my presentation over communication and meeting some of those nurse executive topics, that would really help the unit. So that's what I did. So after we kind of went over it here and there, really kind of talked about what the struggles were, we kind of determined that 2 things were happening. Management was having to change things to be in compliance with the healthcare system. And the way that they were communicating those changes to the staff, it wasn't being received very well. And then the second issue was that staff was not communicating very well to their patient population, because they've been umbrellaed underneath this healthcare system. Their patient population had changed. They were used to dealing with primarily dementia patients. Now, these patients were the extreme of the dementia patients. These are patients that could no longer be in a assisted living nursing facility under general nursing cares. These patients came from anywhere from 3 to 14 days, sometimes a little more depending on the patient, regarding maybe med compliance or adjustment in medications, because their behaviors were extremely combative, and the regular nursing cares in their facilities just couldn't handle them. So the staff at the time were having a hard time communicating with these patients, and what I mean by that is either A, they were not communicating because, well, these patients have dementia, so they're not going to remember anyway, or B, the way that they were communicating, it wasn't very therapeutic, so these patients weren't being very receptive to what was being asked of them. So it was my job to try to come up with a presentation that kind of encompassed not only something that would fit my needs as the student, but fit the needs of the staff and of management, and try to make sure everybody was on the same page. So the purpose that I came up with was to provide a basic understanding of what communication is and how it's utilized in the nurse's work life. So the population that I was speaking to was not only management, it was the directors, it was social work, LPNs, registered nurses, HUCs, and management of the CNAs. So I had a variety of participants in my presentations. The way that I did that was I created a PowerPoint presentation, a 20-minute PowerPoint presentation, and it kind of outlined what is informal communication versus formal communication, what is interpersonal conflict versus intrapersonal conflict, and how that keeps us from communicating clearly. And then I went over just a basic communication loop. How does one send a message and receive a message, and what are all the things that could inhibit that encoding and decoding process? It's a very complicated process to try to eliminate down to 20 minutes, but I think that they understood the basics for the most part. So the things that I just addressed in this presentation, not only those specific terms or concepts of communication, but how does that relate to what we do in nursing? How does that relate to what management does when they pass down a policy from the system to the unit? And I did that by trying to loop it back through the literature that I found. Most often I find that in the literature review that the issues when dealing with communication in a unit is that management is not communicating effectively. So they're not figuring out how their specific unit communicates, and they're not utilizing those specific ways to give a clear message, a clear and concise message of what their expectations are. And I'll give an example. Amory, Wisconsin, Amory Medical Center, before it became Health Partners, was doing a night shift check. So they would go down through the patient rooms and just check on the patients and make sure they were doing, or they were sleeping, or if they were up toileting, or whatever the activity was during the nighttime hours, at least once an hour. But they didn't have an actual recording process other than if they had an activity like getting up to use the restroom, or if they were having behaviors like pacing or agitated, they couldn't get to sleep. They weren't actually recording any of a baseline other than the outliers of those behaviors in the electrical charting system. So when Health Partners came in and said, no, we're going to do nightly checks, we're going to do them every hour on the hour, and you have an algorithm you have to get through and sign off on. When these checks then started coming around, and management was having to pull people into the office and give them disciplinary action because they weren't filling them out, these nurses and LPNs were very confused as to why it was necessary, since they had been doing the check, they just didn't fill out the paperwork. So again, it was one of those things where management knew why it was important, but weren't communicating why it was important for staff to follow the new change. So it was my job to kind of help them understand how to communicate with each other. Then you also have the secondary issue, which is staff communicating to patient populations. So these dementia patients, you often have patients with dementia who don't remember. That's the primary issue, is they don't remember. They have cyclical behaviors like repeating the same statements or doing the same behaviors over and over and over again because their memory doesn't log that they've already completed that action or have already stated that statement or have already asked that question. So these staff members are being bombarded with these behaviors, and they don't know how to cope, and they don't know how to communicate with these patients effectively, whether that be for medication compliance, whether that be for instructions on let's get up and go to the bathroom. So it became an issue of how do we help these staff members communicate therapeutically to their patients. Now throw in the mix that this is not just a dementia unit or a memory care unit. These patients aren't the primary behaviors. You're going to see the different types of behaviors that you would expect on a behavioral health unit. So you would see suicidal ideation, you would see schizophrenia, and because these patient behaviors were so few and far between in these geriatric populations, the staff were not sure how to deal with or how to speak to, and therefore they weren't speaking to these patients, or they weren't communicating appropriately. And what I mean by that is someone in an explosive behavior where they explode maybe obscenities or aggressive behavior and then go back to being their mild and timid self, a staff member who's not properly understanding the way that that disease process works may be offended and then react instead of proactively saying, this is not you, this is just that mental health disease that you're dealing with. So then when you have a patient saying, well, I'm fat, and a staff member saying, well, then don't eat that piece of cake that's on your plate. That's not very appropriate. So again, trying to help the staff learn how to communicate with these patients with difficult behaviors. That was my job during this presentation. So now I did that using, again, those few key basic terms, basic concepts in communication, and then I kind of morphed that into what do we use on a daily basis. So staff-to-staff reporting, we use an SBAR tool. How do we do that? We go to the situation, background assessment, and recommendation. Okay. Then we talked about a GER tool. Now in this GER tool, we talked about it talks about therapeutic communication and how to do that appropriately. Gives kind of a overall sense as to how to listen appropriately, what kind of questions to ask, and then how to allow time for the patient to respond. And they do that by greeting, respectful listening, review, recommendation, or request for more information, and a reward. And I felt like this tool was a really good tool for those patients who had these outlier behaviors. It wouldn't work so well with the dementia patients, but it would work well with the outlying patient behaviors. You can welcome their information, welcome their reality, and try to understand where they're coming from, and then encourage them to see, maybe redirect them into what a normal reality is, or redirect them into the activity that you're doing, or the request that you're making, whether that be getting up and taking medications, or doing some toileting, or let's getting ready for hygiene, or bedtime. So giving them these tools in a handout was easy for them to then put them in like a pocket and say, can I read these and use them in my patient population today. So after going over these and kind of doing like an active simulation between me and the audience and really having a whole conversation, I think it really kind of helped ingrain their comfort level in asking these types of questions, really waiting for the answer, and really welcoming further conversation. At the end of the presentation, I also did an active listening activity in which I read a paragraph extremely fast and asked them to repeat to me some key pieces of information, just to see how well are they listening. Because I think that oftentimes people with communication issues aren't actually hearing the question or aren't actually hearing the information. They're already thinking ahead or thinking to the next thing versus actually taking the time to listen to the request, process, and then give an answer. So I think that worked really well. I think it was received really well. I think the issues that I faced in this presentation were a couple fold due to time overlap and staff underwhelmment. They were underwhelmed with staff that day, so I had to actually split my presentation in half. I did one presentation with one set of staff, and then we switched, and I did the whole presentation again with the second set of staff to try to cover everybody, but it was a little more difficult because you do have those staff members who are a little more outgoing than others. And because we had to do it that way, we couldn't go down into the conference room. They have a projector down there, which would have made the PowerPoint presentation far easier. So we did have to kind of modify. I printed out the slides and I passed them out in a handout. And then I used my small computer as kind of the projector screen, so I knew it was kind of difficult for the audience to see. So those were the kind of issues I faced. But overall, I think it was received pretty well. My takeaways from this whole experience is that you have to be the example. It doesn't start with management. It doesn't start with someone else. It starts with me. I have to be the one to instill the change. I have to be the one to facilitate that. So whether that be getting involved in committees to discuss the issues that we face on a day-to-day as staff. My perspective has changed, not just looking at it as a staff member, but looking at it in the way, looking at it from the direction of administration. What are they thinking about that I'm not thinking about? Other than that, I think it went really well, and I hope that this was informational. I hope I didn't ramble too long. Thank you for listening, and I hope that everyone has a really good end of semester and a great summer. Thank you very much.